Hello there, I'm Kate Miles from the Mind Body Reset, and I'm here today to talk to you about headaches and migraines. Now, migraines feel very different to simple headaches, as they are associated with a whole host of other symptoms, such as aura, which are flashing lights or a shimmery effect on the edge of your vision, photophobia, light sensitivity, and a heightened reactivity to smell, and possibly even a temporary loss of vision, as well as often one-sided headaches of extreme intensity. So headaches and migraines are not the same thing. A headache is a standalone entity, and migraine is a more complex condition. However, they can both be triggered by muscle tension, eye strain, and repetitive upper body posture, leading to mechanical strain, and the inhalation or ingestion of chemicals. But migraines especially can have an allergic, hormonal, or toxic reaction leaning, and are commonly triggered by cheese, coffee, chocolate, and alcohol. Now, stress is, of course, a huge factor. When we are stressed, our muscles tighten, especially through our upper bodies. And as many of these muscles attach onto our heads, they clamp our skulls and irritate our nervous systems, which can trigger a headache or migraine. So if we have a history of long-term stress or trauma, then this vice-like effect can become ongoing. Eye strain is also a factor, especially if you spend a lot of time driving or looking at screens. So if you don't wear glasses but really need to, if you don't wear your glasses as often as you should, if your prescription needs updating, or you have switched to varifocals and haven't changed the height of your computer screen, then your eyes will be under extra tension, which sends messages to the visual cortex of your brain, found at the back of your head, and tightening the local muscles as a consequence, and increasing your chances of an attack. If you sit a great deal, you will probably be prone to slumping and slouching, which increases the mechanical strain in your neck, shoulders, and head, making it more likely that you will suffer from headaches. Also, if you tip your head back regularly during your repetitive activities, your upper body will be vulnerable to mechanical strain and headaches or migraines. Now, if you use volatile compounds like the chemicals found in paints or glues, you have a highly processed diet, or you need to take a lot of non-prescription or prescribed medication, then you may actually be a candidate. But you must stay on your medication unless specifically advised not to by a GP. So what might help? Now, it's worth visiting your optometrist, limiting screen time, adopting an upright posture while sat at your workstation, upgrading to contour pillows, and opting for recliner chairs. Upper body stretches may also be of benefit, but do ask your practitioner for guidance. Either a face-to-face cranial osteopathy or a remote osteoduce energy healing checkup will gently loosen skull tension and address your spinal mechanics. If your symptoms are more stress-related though, then do consider sentimentology, a hybrid of hypnotherapy, guided visualization, and lucid dreaming, which can help you unlock your emotional clutter, often without feeling the need to over-discuss your past or re-stimulate old traumas, therefore allowing your symptoms to be gently diffused. On the self-help front, cleaning up your diet and avoiding your trigger foods is also key. Plus, increasing your water intake to avoid chronic dehydration can really help. But do so gradually for better absorption, and consider a nutritionist for a tailored to you dietary plan. Wear a mask when using chemicals or cleaning products, and switch to more eco-friendly low VOC options, as this will help to reduce the frequency of your attacks. Even your cosmetics, especially those you breathe in or that come into contact with your skin, can be a symptom-inducing issue, so do consider using greener alternatives where possible. Exercise can be very helpful as a stress buster, so a 10-minute walk in a nourishing environment, or even just brief episodes of sitting out in nature, can make a difference. You may not be up for this during an attack, however, but if you make some time in your week on a regular basis as a preventative measure, you may feel far better for it. Journaling, gratitude practices, breathing exercises, mindfulness meditation, and EFT tapping, along with numerous other wellness approaches and self-help options, when used on a daily or weekly basis, are really useful ways to work through your past, present, and future concerns, and their benefit increases immeasurably when undertaken in conjunction with treatment or talking therapy. If you're interested in chatting with me about your health, please DM me to ask a question, book a health boost audit, or request a discovery call. Thank you for watching. I hope you found that helpful. Bye bye.